Okay, everyone, thank you so much for joining. My name is Maytel Weiss. I am a Director of Business Development at the FreeMind Group. And today we'll be talking about biodefense and infectious diseases funding opportunities. This deck will be available at the handout section within the GoToWebinar toolbar, I suppose. We have a series of these webinars, and you're very welcome to check them out on the FreeMind website. So firstly, FreeMind is a consulting firm. We've been around for about 20 years now, have 75 full-time employees, and a very diverse client base. We work with academics, university medical centers, but most of the work we do is definitely with the industry, anything from very, very early stage companies all the way up to Lilly, J&J, and Pfizer. And the way we view the work that we do, and I suppose the consultants here and the strategists and the professional department itself, we see ourselves as a tool to help you maximize your funding potential. We're here to help you identify the most relevant funding opportunities, strategize and maximize the application's chances of success, manage complex production processes, lead a joint application writing, and of course support final contract negotiations, and help you utilize non-dilutive funding as a strategic financial tool. So before we dive in, let me talk about the NIH for a minute. The 2019 budget was actually increased with about $2 billion. And what's great about the NIH's budget pie chart is that most of that funds, and we're talking about $29 million, go out to fund extramural research. So obviously that's great. And today, as we talk about infectious diseases, we'll talk a lot about NIAID, which is the National Institute of Allergy and Infectious Diseases. And as the NIH budget grows, NIAID's budget has been growing as well. We're almost at $5.6 billion. So what this graph roughly reflects is the fact that the interest of these funding agencies in biodefense in infectious diseases has been growing in the past years, which is obviously great for everyone joining since you are within that field. So as we talk about NIAID, again, the National Institute of Allergy and Infectious Diseases, they have a few bugs of interest. So of course, newly appeared within the population or existed, but rapidly increasing or, within some kind of crisis that's approaching us, and are caused by one of their category A, B, or C of bugs. So with group A, we have anthrax, we have dengue, Ebola. Group B has tuberculosis, salmonella, hepatitis A. Group C has yellow fever, influenza, rabies, SARS, and the list is ongoing, but it's not endless. So I left a link here, and you're very welcome to check it out and make sure that you are within their scope. And as we talk about funding opportunities today, we usually make a distinction between three different groups. The first one is solicited applications. These are funding opportunities that address specific interests of the funding agency, and we'll definitely talk about them as well. Second group, the largest group, is the unsolicited one, or the parent announcements, where you will not see dengue in the title, and you will not see the specific research that you would like to do, but you're actually invited to pitch your idea to the NIH. We're talking about investigator-initiated R21s, R01s, SBIRs, and the challenge here is to try to establish the interests prior to submission, meaning talk to the program officers, make sure that they are interested in what you're doing, because you won't see the specifics within the headline. And the third part, and the third kind, sorry, is the broad agency announcements, or the BAAs. These are usually more associated with BARDA, Army-related opportunities, and we'll be covering all three subgroups within this presentation. So let's actually start with the unsolicited ones. The first two type of opportunities are the R01 and the R21 Omnibus solicitations with the NIH. We're talking about parent announcements, and we'll be going into some specifics, but every time we say in R21 or in R01, we'll probably be talking about, in terms of the structure of the grant itself, about these two opportunities. So the R21 is the early stage grant, exploratory developmental research grant program with the NIH. We're talking about $275,000 in direct costs. And on top of that, you can add the overhead components, typically 35–40% for domestic companies, up to 8% if you're not domestic. And obviously, we can talk about it offline if anyone has questions. These, the R21s are up to 2 years. And if you sum up everything, you end up with about $300,000 total. The R01 is the larger opportunity. They just call it research project grant. And these are opportunities that are up to $500,000 a year for up to 5 years. You add on top of that the overhead component, similar to what I've said with the R21. And as you sum up everything together, you end up with about $3 million in total. The NIH removed the budget cap from the R01 solicitations a few months ago. So technically, as you look at the opportunities, you will not see that cap. But bear in mind that, this is more or less what they would like to fund as a part of that opportunity. They'll be happy to discuss. But make sure that you're not asking for more than that before you talk to a program officer and get their okay, just to make sure that you're not writing an application that will not be compliant and wasting your time. So the deadlines are February, June, and October, both for the R1 and the R21. And until very recently, when we talked about parent solicitations, we talked about these two. Something very new and exciting happened with the NIH very recently, and they've actually split and divided these opportunities to subgroups as well. So I would like to take the time and show you the specifics of those. Let's start with the R21. So they now have 3 solicitations. The difference is that one has the requirement of basic experimental studies with human as a requirement. I include the entire name of the solicitation and the parent announcement number, so you can just Google any part of that you would like, even the the PA 19092 will do. The second kind is an R21 in which a clinical trial is not allowed. Third kind is a clinical trial required, R21. And this is a big deal. It just goes to show that they are making a shift towards the parent announcements to not box you into something they thought of before. So this is actually excellent news. Now the R01s. So again, divided into a grant that requires experimental studies with humans. Second one, clinical trial required. And the third one, clinical trials not allowed. Make sure that as you're submitting your grants, you're sending them to the right category, because obviously it is important to them to distinguish. And another type of applications that I would like to talk about is the SBIR and STTR Omnibus solicitations. These are basically opportunities or granting opportunities for small businesses, US owned, when the work is done entirely within the US. I will not go into the specifics of the SBIR and STTR eligibility criteria. There's plenty of webinars regarding that within our YouTube channel. And of course, if you have any questions, I'll be very happy to answer as we're done. But the SBIRs and STTRs are divided into two phases. The phase one, and I'll start with the SBIR here, $225,000 for up to 6 months. Phase two, $1.5 million up to 2 years. You can submit a direct to phase two, basically skipping the phase one, and you can also submit a fast track that includes the phase one and the phase two. The STTR, Omnibus solicitation with the NIH, is a grant made out to support industry academia collaborations. Make sure that you're talking to your local SBA before submitting one of these. The phase one is $225,000 up to 12 months, and the phase two is $1.5 million up to 2 years. And they've split out the SBIR and STTR solicitations as well. So the first couple is the SBIRs. First one, clinical trial not allowed. Second one, clinical trial required. With the STTRs, sorry, with the, oh, that was the STTR, sorry. So with the SBIRs, again, clinical trial not allowed and clinical trial required. You have all the numbers. Make sure that you're submitting to the right opportunity as you do. Again, this is something that is new, so make sure that you're aware. And now let's talk about the solicited opportunities with the NIH. We're going to start with the preclinical opportunities. So the first one that we'll be talking about is Countermeasures Against Chemical Threats. It's an initiative called CounterACT, Identification of Therapeutic Lead Compounds. This is a U01. I added the solicitation number. The funding is up to $300,000 per year for up to 3 years, so $900,000 for the grant. On top of that, you can also add the indirect component that we mentioned before, but note that you can only ask for up to $1.2 million total. The scope is to develop new and improved therapeutics to treat and or prevent injuries resulting from chemical threats. And the supported activities are confirmation of molecular targets, demonstration of in vitro activity, preliminary in vivo efficacy, preliminary ADME or tox evaluations, and PK/PD data. The deadline, the next deadline is September 10th, 2019, so there's still time. Another preclinical opportunity is a U01. This one does not even have a budget cap. And unlike the R01s, you can definitely ask for a bit more. And, you know, we do recommend getting the approval, but it's a bit easier. The scope is to support GLP IND enabling safety studies and pivotal efficacy studies in animals, cGMP production, and human safety clinical trials. And another important thing to note is that this opportunity is viewed by BARDA, and we'll talk about BARDA in a minute, as a stepping stone towards receiving the BARDA support. And these are the very, very large grants. When we're talking about clinical funding, obviously it's a very different size of grants. If you want to do a phase 2 study, getting $300,000 will not get you very far. And before even submitting it, I would like to show you a grant that personally I think is wonderful. It's actually a clinical trial planning grant. So if you'll think about it for a minute, the goal of the NIH in this aspect is to fund you. And in order to, for them to do that and make sure that they are supporting work that is good, they'll even help you, establishing the clinical trial, talking to the experts, forming the collaborations that you need. They'll help you with the study design, the protocol development, and other activities. So the grant is up to $200,000 within the planning round, and it's typically a very good stage if you're going to go for the clinical grant itself. And here it is, the NIAID Clinical Trial Implementation Cooperation Agreement. This one definitely does not have a budget cap. We're talking about a 5-year long study, and they'll accept applications for implementation of investigator-initiated high-risk clinical trials and mechanistic studies associated with high-risk clinical trials. Note that this grant has a low-risk, I would say, sister, an R01 opportunity, and an SBIR equivalent. So definitely look at those as well. And just before we move past the NIH, let me talk a bit about the NIH review process itself. So I know that we think about grants being reviewed as a very scientific process, but it's more of a risk assessment process. They have to make sure that the strength of the application is more apparent than the risk associated with funding you. And for this, they have a 5 review criteria system. The first one, the most important one, is the scientific approach. What do you plan to do with the money, your study design, your specific aims, how you plan to make sure that you are validating your hypothesis. Second one is the innovation and the significance. So I'll start with the significance. Obviously, you'll have to explain why the work you do is important, why it's important to what the NIH would like to do. They would also want to make sure that you're taking a very innovative approach about it. So definitely make sure that if you're solving a problem, you're doing it in a very new and exciting way, because they will be impressed by that as well. You have to make sure that the people leading the process are very, very talented, that they are able to see the project through. And lastly, environment. If you're planning as some kind of study that requires animal work or microscopy, for example, and you don't have a microscope, that might be a problem. So make sure that you're conducting the work, or as you plan ahead, make sure that you're showing them that the work will be done in an environment that will be able to see the project through as well. And now I want to talk about BARDA, the Biomedical Advanced Research and Development Authority. BARDA actually just received a budget increase, and their goal is to develop and procure medical countermeasures that address chemical, biological, radiological, and nuclear accidents, incidents, and attacks, pandemic influenza, and emerging infectious diseases. The sweet spot for BARDA is clinical projects, very advanced projects. They're here to help you gap the valley of death. And these awards are definitely large, all clinical, typically even phase 2 and up. These are great opportunities. Some of the awards are huge, hundreds of millions of dollars, if you're able to justify it, of course. And if you're into infectious diseases, vaccines, technology related to these indications, BARDA is definitely a very, very important ally that you should be looking to. And we talked about the NIH review process, but let me share a bit about the one that they have in BARDA, because it's not always as intuitive as what we see with the NIH. So first of all, you start with a white paper. It is a very short summary of what you plan on doing, typically 5 to 10 pages long. You send that over to them, and then the application is reviewed. It is important to note that most applications don't make it past that stage. So as you write it, be very, very careful and make sure that you are able to distinguish yourselves from other opportunities out there and other applicants out there, and increase your chances. After the review process, hopefully, you'll be invited to submit the full application. That application is much larger. It takes longer to prepare. And then you're submitting the full BARDA application. It's reviewed again, and then hopefully you're awarded and happy. So this is a BARDA solicitation. In terms of the funding, so obviously no budget cap. They have extremely high funding levels possible. The scope is clinical development of vaccines, antitoxins, and therapeutic proteins, antimicrobial therapeutics, radiological or nuclear threat medical countermeasures, chemical threat medical countermeasures, and clinical diagnostics. The deadline is rolling, meaning you can just submit the application when you're ready. Another program as a part of BARDA is CARB-X, and their goal is to protect humanity from most serious bacterial threats by accelerating antibacterial products that will be developed over the next 25 years. So I told you before that BARDA aims at funding work that is in a very late stage. And CARB-X is the exact opposite. So they'll be very happy to help you fund preclinical work or a phase 1 project. And they're mostly interested in antibiotics-resistant bacteria, but definitely talk to them if you're doing something that might be relevant as well. Another initiative with BARDA is the DRIVE-E, which is the BARDA Division of Research, Innovation, and Ventures. This is a relatively new program. CARB-X has been around for about 2 years, and the DRIVE initiative is only here, has only been announced in the past few months. And their mission is to accelerate the development and availability of transformative technologies and approaches to protect Americans from health security threats. In order to submit, you need to basically hand in a very short abstract. All stages of development are accepted, and although it's not mandatory, they do recommend cost sharing to make sure that you are, serious in a way. The budget is up to $749,000, and one of their interest area is sepsis. So if you do any work with sepsis, definitely look at DRIVE. And if you want to hear a bit more about these two programs specifically, it was the beginning of the month, we had our event in San Francisco, and we had Tyler McClary from BARDA give a talk about CARB-X and DRIVE, the differences, how they came to be, and I added the link below. And generally speaking, you'll find a lot of very interesting talks from that day within our YouTube channel. So follow the link, you'll see them all. And as we dive into the Department of Defense, I would like to talk about 3 specific programs. One of them is DARPA. The second one is DTRA, and the third one is USAMRAC. So DARPA is the Defense Advanced Research Project Agency. DTRA is the Defense Threat Reduction Agency, and USAMRAC is the U.S. Army Medical Research and Material Command. They all do work within the biodefense field. DARPA is here to maintain the technological superiority of the U.S. military by sponsoring revolutionary, high payoff research that bridges the gap between fundamental discoveries and their military use. With DTRA, they're here to safeguard the United States and its allies from weapons of mass destruction, and USAMRAC provides solutions to medical problems of importance to the American warfighter at home and abroad. So let's start with DTRA, Defense Threat Reduction Agency. They have a program with no budget cap, and of course you'll have to justify the budget that you request. In terms of the scope, detection of both chemical and biological agents, information systems capability development, protection against individuals and the collective, hazard mitigation, threat agent science, medical partnerships, medical diagnostics, medical therapeutics, and threat surveillance, both chemical and biological. The deadline is rolling, so you can just go ahead and submit when you're ready. Second one is the U.S. Army Medical Research and Material Command. We call you SAMRAC. We know that it doesn't make sense in terms of the letters, but that's how I'll be, especially here, referring to that. So here's the solicitation, that very, very long list of letters and numbers. No budget cap here. Also, of course, you'll have to justify the budget that you're asking for. And in terms of their scope, they aim to provide solutions for medical problems of importance to the American soldier, military, infectious diseases, combat casualty care, military operational medicine, clinical and rehabilitative medicine, military biological defense, medical chemical defense, medical simulation, and information sciences. And third one is DARPA, Defense Advanced Research Projects Agency. Here, you'll have a budget cap of $750,000 per grant. Their scope is to leverage biology as a technology to solve intractable problems. It seeks to leverage advantage and engineering and computer science to drive and reshape biotechnology for national security. So this is more technical here. Interested in a range of emerging technical areas, including human-machine interface, human performance, infectious disease, and synthetic biology. And the goal is to develop, demonstrate, and transition biologically based technologies as a part of the national security toolkit. The deadline is rolling as well, so of course, submit when you're ready. And the solicitation number is also listed above. And another program with the U.S. Army is the CDMRP, the Congressionally Directed Medical Research Programs. I will not go into all of the different programs within the CDMRPs. We will definitely have an excellent webinar on that, and I don't want to spoil the fun. But just in this context, I'd like to talk about two topics that they listed that are relevant to us here. So the first one is emerging infectious diseases. They have four different subcategories. You can definitely look it up. Again, the slide will be available when we're done. So the first one is emerging infectious diseases. Second one is antimicrobial resistance, and they list anything you can come up with probably. And these are the two topics that the CDMRPs are also funding. The topics just came out a few weeks ago. They have a single deadline, and it varies between the different indications, so make sure that you look it up. These are wonderful grants. They have 4 different stages of development, so from very early stage work all the way up to very advanced clinical trials. And definitely look it up. The CDMRP website is very helpful, and we definitely recommend it. And maybe just to sum up what we think is a good strategy here. So I know we just spent about 30 minutes talking about non-dilutive funding, but we think that your way of maximizing the work that you do is through a very balanced approach. So, of course, submit to angels, submit to VCs, public markets as well, but you cannot exclude the non-dilutive funding portion of your funding strategy, because it's just, the money's great, and it's just not something that typically we recommend leaving out. And as you go on submitting non-dilutive funding, make sure that you lower the risk for the funding agencies. We definitely recommend using and looking at them as investors. They have a different list of interests, but they're investments like any other. So in order to lower your risk, know your weaknesses. Don't tiptoe around them, talk about them, address them. Obviously, you're aware of your weak spots and you have ways of overcoming them. Don't be afraid to talk about that. Find the right partners if necessary. It's not a must. Most of these opportunities don't even require a partner. But if you're doing a kidney-related project and you don't have a kidney expert, that might be a problem. Know the interests of the funding agency and the mechanism. We talked a bit about the R1, we talked about the R21s and the SBIRs. Make sure that you read the solicitation. Address the non-important administrative aspects. And I know that we called it unimportant, but these are actually critical. I've written many grants myself as a part of the FreeMind Group, and I can tell you that when people tell me that they've spent 3 months writing an application and then found out that they can't really apply because they missed something, it's just heartbreaking. So make sure that all your administrative ducks are in a row. And also establish yourself both as a top researcher and an experienced manager. They're not just looking for the scientific expert. They're looking for someone to take the project that they're funding from point A to point B. And if you're not a qualified manager, that might be a problem for them as well. And, you know, after about 20 years of doing this, we find that the way to maximize your funding potential is to, first of all, identify all of the relevant funding opportunities, create a multi-submission granting strategy, and then submit as many top quality applications as possible. Make sure that you're not just submitting something to have something in, because you are building yourself a reputation within the NIH, within the DoD, within BARDA. So if you're not submitting something that is high quality, it will not be awarded, and it might be frowned upon if you're submitting 5 applications that are not polished. So that's us. Thank you very much for listening. If you have any questions, obviously feel free to email me or call. There is a link to our website, to our LinkedIn account, our Twitter, and our YouTube channel that has a lot of very useful information. And now let's look at some questions. Just a minute. Okay. Do you have to be an educational institute to receive R1s? So no, that's something that we hear a lot. So you can definitely submit R1s, R21s without being a part of academia. A lot of industry players submit R1s, submit R21s, and are definitely awarded. And actually, the NIH is doing a lot to make these grants attractive for the industry as well. And I'll just give you a very short example. To those of you who have written these grants before, an important element is something called a biosketch, which is basically your scientific CV. And until, I would say a couple years ago, they had a section called publications. And that part was very, very challenging for people that have been with the industry for a long time, have been doing very, very impressive work, but did not publish it because that's not how the industry always works. And when we got to that section, it was also very problematic for them to be able to explain, listen, we know what we're doing, we are very experienced. And they actually changed that section from being publications to contributions to science, to make sure that you are able to explain what kind of work you've done before. So definitely submit R1s, submit R21s, even if you are a commercial company. Okay, and how's European companies' grant success rates compared to US-based companies? So the only difference between a domestic application and a non-US application is something called foreign justification. We're talking about a relatively short document, about 2 pages long, and you're basically explaining why the work you do cannot be completed by anyone else but you. You might have the know-hows, the patents. This might be something that you, in terms of the approach that you came up with yourself. And if you're able to make that claim, which is not something that is very problematic, we don't really see a difference as long as the science is amazing. If you're submitting excellent science, it's not as important where you come from. It's what you bring to the table. If you're able to show them that the project that you're planning is something that is worthwhile for them, they'll be very happy to fund you. Of course, bear in mind that there are some exceptions to this, not so much with NIAID, but with some institutes of the NIH, it is a bit more problematic. And if there's something specific, I'll be very happy to talk about this offline. With the DoD and BARDA, it's actually even easier. It's not about geography. They're very happy to fund foreign applicants. If you'll think about it for a minute, they set the rules. They decide what's interesting for them. And if the work you do is relevant to problems they would like solved, they'll be very happy to help you do that for them. And how to watch my webinar presentation again. Do we have a link? Yes. So first of all, the slide deck itself is actually available at the handout section here. And everything will be on our YouTube channel. Our marketing director will probably upload it either tomorrow or early next week. And I'll send out an email with the link to everyone. So thank you very much for joining me. I hope you found this webinar useful. And again, if you have any additional questions, please feel free to contact me or any of us. And have an excellent day. Bye.